Hello, my name is Kirk and I want to welcome you to our May edition of our YouTube channel, updates about Schenectady ARC and about some of the events in the outside world that have an impact on what we do and how we do it. So today I want to talk a little bit about the public health emergency that was enacted with the start of the COVID pandemic. The public health emergency was a federal declaration. It allowed the state and the federal government to give us some flexibilities in how we provide some of our services. It specifically applied to some of our Medicaid funded services. It allowed for us to do telehealth in ways that hadn't been previously permitted. It allowed us to serve people in our houses so people could stay home and stay safe, but still get some of the services they needed. All of that is going to change this year in the next 6 to 8 months. The public health emergency is slated to come to an end on May 11th, 2 days from when we're filming this clip. So the end of the public health emergency on May 11th means some things are going to change immediately. Other things, we have a 6-month period of time to transition back to the new set of norms that are governing how we serve people and how we support people. So what did it allow and what is it going to be affected? We could do telehealth in ways that weren't permitted before the public health emergency. We could provide services in our houses, and again, it allowed and authorized all the different safety measures that were there. The end of the public health emergency means some things will change. The interesting thing is we learned a lot from what we could do and how we provided services during the pandemic. And telehealth is probably the best example. Telehealth is something that was difficult to provide before the pandemic because of the restrictions imposed by Medicaid and Medicare and other payers for the services we provide. With the public health emergency and with COVID, we realized that you could be very effective. And in fact, many services are even more effective when they're provided through telehealth. So after the public health emergency, there will be some changes, but we will still have the ability to use telehealth in situations where it really meets individuals' needs. So you may see some differences and you may have to fill out different documentation if you or a family member is going to use telehealth. But again, it may be available in a way that's very similar to the past. For us, the biggest change will come with the day services that we provide. The enactment of the public health emergency allowed us to keep people home, to keep people safe, but still provide services. With the end of the public health emergency, and most of this is going to happen in November, we have a period of time to transition. We have we will be doing much more in the community and at our sites. Our Maple Ridge Center program is going to become a much busier place with the end of the public health emergency. We're looking at transitioning and enhancing our day supports so we can do things for people in the community. We can use Maple Ridge as a site for programs for people who previously were being supported at their home. And we're going to make that transition over the next 6 months. So I think what you will see and hear is things will be a little bit different. Things will be still offered. If you're getting a service now, you will continue to get it, but it may look a little bit different. One of our big challenges still, and it has nothing to do with the public health emergency, is workforce. So we are restrained by the number of people we can employ. That limits the number of services we can offer. But we are working to develop what we can do in the community, working with the resources we have, and looking to enhance and grow our community-based models of support. So you will be hearing about changes, you will be seeing some different services. Stay in touch with us, stay in touch with your care manager if you're getting care coordination services, and they'll be telling you about the different options that are there and how our service models will change over the next 6 months. So thank you, and stay tuned for the next installment will come in June. Thanks.